Okay, hello, Pahrump. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, and today is Monday, March the 2nd. I almost said it the 3rd, but it is March the 2nd, and this show is live, so I believe the number down there will be to call in is 727-8750. That is 727-8750. If you have any questions or comments or concerns, please feel free to call in, and we'll try and have a discussion about whatever is on your mind that is related to what is medical. Nothing new really going on in the medical community. Kind of been busy taking care of business in the office and thinking about different topics for the show. I kind of wanted to revisit one of the topics that I've talked about before, which is chronic obstructive pulmonary disease. It is a disease that is very prominent in today's society. It seems to be very prominent in the town of Pahrump because of the age of our population and the people who inhabit this remote geographic area. And because we're a retirement community, we are left with a lot of the people who, I remember when I was a little boy, it just seemed like everybody smoked. My parents smoked, and everybody around them smoked. So with that being said, it's not uncommon that we have a lot of COPD and chronic obstructive pulmonary disease affecting us today. And the term emphysema and chronic obstructive pulmonary disease is used interchangeably, but really COPD is chronic bronchitis, or what they call the pink puffer, and what that is basically the airways become obstructed over time. And I'll have some slides that we'll be able to bring up later that will better illustrate that for you. But smoking, the reason smoking is such a problem, and I've talked about it on the show, and why you should quit smoking if you could at any time. We talked about the lungs being cleared within the first 3 or 4 days, and returning your lungs almost to near normal health within 6 months. And smoking is a very strong irritant to the lung tissue. And if you notice people that work with their hands, they develop a lot of calluses and hard spots. And that people are out in the sun, they call them rednecks. And this is your body's natural protection against an insult. Smoking is one of these diseases that basically is such an irritant to the bronchial mucosa that it changes it from this nice columnar, which we call columnar meaning high or long epithelial cells and mucus cells, and basically they become skin cells. It transforms them into a hard surface because of this chronic irritant that is in presence. And what happens on the back of your neck, the sun causes a sunburn, and the skin on your back basically responds to that by becoming thicker and becoming harder and more resistant to the sun. And the same thing would happen with your hands. So as you start to use your hands, they become thicker in response to the stress, just like calluses on your feet. Hey, Ray, are you on the phone?
Yes, I am, Doc. How's it going tonight?
Well, great. How are you doing? Thanks for calling in. What's up?
I watched a show on satellite TV over the weekend. I watched it. It's called Intelligence for Your Life.
Okay.
And they said people with migraines can relieve the pain of the migraine by putting an ice pack under their chin against their throat. It does something with the blood. I wonder if you can confirm that. And my second question is there a home remedy for heartburn? When I get heartburn, I use baking soda, and I don't know if that's good or bad, but is there something else I can use other than going, over-the-counter stuff? If you could help me out, either one of those, I'd appreciate it.
Oh, yeah. Well, with regards to the migraine phenomenon is basically a vascular headache, and that's what they call it. But there is a aura phase to the headache. What that means is a lot of people will have a prodrome to the headache. They will get a visual scotomata. They'll see flashing lights, or they'll have fractured vision. And that part is vasoconstriction, meaning the blood vessels to your cerebral meninges, the lining of your brain, they constrict. And they also constrict the circulation to your eye, and when that happens, you'll get these visual changes. Some people may notice changes associated with smell or taste or things of that nature. And it's very careful. You have to be very careful not to have this mixed up with a seizure disorder, because some mild seizure disorders can actually cause changes in smell and taste and other visual or other sensations, and then you might get a headache in response to that. So sometimes if you're not sure, neurology has to be consulted. But back to your question with regards to ice, once the vessels constrict, they basically then dilate. And when they dilate, they allow fluid to enter into the meninges of the brain, which is the lining of the brain, and that's what causes the headache, sometimes very severe, sometimes with photophobia, which means light hurts your eyes. And so that entailed the cure for that would have been vasoconstriction. So the drugs that have been available for migraine have been beta blockers to prevent this vaso-expansion issue, vasoconstriction, and then calcium channel blockers, which also stabilize the integrity of the blood vessel. There are some people who actually get scotomata, or these changes in their eyes, without ever having headaches. So therefore, but if you get that and then you get a headache, then it's a true migraine. And sometimes they were giving people, long after the effect, once the tissue fluids have moved out, there really isn't anything you can do for it except sleep it off. So if you catch it early enough, you can prevent this vasoconstrictive phase from opening up, then you can prevent the headache, and that's where Imitrex and some of these other, what they call triptan drugs, have come into effect, and they're contraindicated in people with heart disease because they're vasoconstrictive agents. And if anybody's ever had a migraine and taken them, they might actually feel a little tightness in their chest, because that's what these products actually do. But actually, it's more in the esophagus of your throat where you get that sensation from. But putting ice under the skin is basically going to be a vasoconstrictor, so it's actually going to reduce the amount of fluid and blood flow that's flowing into that area, and that's probably your homeopathic remedy for migraines if you could get to it. I don't know if it works. I've never suggested it to patients, but certainly that's where that might work. With regards to your second question, which would be the use of a over-the-counter remedy for your gastrointestinal reflux disease, baking soda certainly is a natural acid reducer. Bicarbonate of soda, it will reduce it, but it does come back, usually sometimes with a vengeance. Milk has been one of those things people took, but actually the calcium in milk caused a hypersecretion of acid afterwards, so that has been reduced to that. Tums, those particular products, again, a calcium carbonate related issue, can give you some temporary relief from that. Other things you can do is obviously eat frequent smaller amounts. You can elevate the head of your bed. What I tell people to do is to get a 2x4, two 2x4s under the foot of their bed, so it elevates about 4 inches. And this will actually help to keep the acid down into your stomach when you're sleeping at night. It also prevents reflux. It also will help open up your nasal passages. And does a lot of good for you. So that's why hospital beds elevate, because they can help you reduce that blood flow down into your legs and help you breathe a little bit better at night. So that's about it for the over-the-counter remedies. If you do take Tums and those things to help calcium in your body, that's actually very good. But if you're using products like omeprazole or any of these proton pump inhibitors, you must use calcium citrate, meaning if your doctor has put you on omeprazole or Protonix or any of these products over the counter that you have the prescription for. That's not Zantac, that's not some of the other Acifex or some of the other, well, Acifex is one of the proton pump inhibitors, but Tagamet used to be one, and Zantac, ranitidine. Those particular drugs, you do not need to worry about the calcium you're taking. But if you're taking omeprazole, then you do need to take calcium citrate, and you have to look for calcium citrate, not calcium carbonate. Meaning if you're taking calcium carbonate for your bones and you're taking omeprazole for your stomach, you're not going to get the calcium in your system. Because the acid is reduced, you will not absorb that calcium into your system. So I hope that answers those particular questions with regards to that. Okay, getting back to the chronic obstructive pulmonary disease, again, we were talking about the changes that took place in your body whenever you were exposed to harmful or noxious substances. And again, smoking is a noxious substance to this nice, fine mucosal lining of the lung. It serves a purpose. You make mucus to trap the dust and the particulates that you breathe, and these nice columnar epithelial cells have a little hair cell on them, and they actually beat the mucus up out of your chest and unknowingly to you over your epiglottis, and where you swallow the mucus and the bacteria in there, and you basically dissolve and eradicate all the stuff. If you didn't have the mucus, this natural clearing mechanism, what I call a pulmonary toilet, so to say, your lungs would fill up with dust and all types of harmful stuff, and basically we wouldn't have much of a life because we would just fill up with dust. So imagine what happens if you lose that mucus clearing mechanism. I mean, you lose that ability to clear that mucus. Well, it forms a mucus plug. And if you form a mucus plug in your small airways, then as your airways expand, air moves over the airway, and as you exhale, it collapses the lung on that mucus plug. Well, that being said, this would be the same process as putting a balloon on the end of a straw and breathing blowing the air into the straw, and whatever, let's suppose you only let 50% of that air out. Take another breath, blow the same amount. Well, you can see what would happen. The balloon will eventually pop. And that's kind of what happens in your lungs, meaning these small microalveoli where we exchange a lot of air and a lot of blood mixes together. It's basically a multiple like grape-like stuff, and then that gets expanded to a balloon, and that surface area goes down from what would be a large surface area to a small surface area and become short of breath. Okay, well, we're going to go to break, and hopefully I'll bring up some slides in a little bit, and we can give you a better pictures are worth 1,000 words. And thank you for tuning in tonight. Always glad to be here.